All right, we'll get started. Good morning, everyone.
Good morning.
We are Healthcare for All New York. We are a coalition of 120 organizations across the state dedicated to the singular goal of affordable, high-quality, comprehensive health coverage for all New Yorkers. I am Sherry Tomasky. I am with the American Cancer Society, and we are a steering committee member of Healthcare for All New York. We will be joined today by various members of our coalition to talk about a number of different projects that we are working on, and also the immediate concern that we have in terms of enacting the exchange under the Affordable Care Act, the federal law that passed in 2010. Yesterday we heard in the Governor's State of the State package, we learned some very encouraging news about the prioritization of the health insurance exchange in our state. And I will tell you that our coalition is deeply gratified to see the health insurance exchange as a priority in 2012, but we have to remember that this is unfinished business. This is not a brand new initiative, and while we are grateful to see that this is put on the list of things that the administration intends to do, this was unfinished from 2011. And in the final days of session, a negotiated bill failed to pass the Senate, and so it put us many, many months behind schedule. So we are already behind the 8 ball as we approach 2012, and our work to establish the exchange is of great importance, and we are under a very urgent timeline to meet the deadlines that New York has to meet in order to have a viable insurance exchange up and running. We are 360 days away from when New York State must prove to the federal government that we have a viable exchange in New York that New York can operate on its own. Without that proof, there will be federal intervention to help set up and run an exchange in New York. That is something that is universally agreed upon that we do not want in the state of New York. We want and can run an exchange on our own. We are 360 days away from having to prove that we have an exchange that can fulfill the needs of the New Yorkers, the 1.2 million New Yorkers that will need this exchange on January 1, 2014. So on January 1, 2013, we have to prove that we are far enough along to run this exchange on our own. That does not give us a lot of time. In fact, it gives us not enough time to operate an exchange in this state. And therefore, Healthcare for All New York is calling on the legislature and the governor to enact establishing legislation for the health insurance exchange as soon as possible. It needs to be done immediately, and it cannot be done any later than the budget process, which concludes on April 1st. It must be done right away if we are going to have an exchange up and running in this state on time and receive the federal funds that we desperately need to operate this exchange, so that New Yorkers can finally purchase affordable, comprehensive health insurance that they cannot get access to right now. So that message is an important one for all of you and our legislators and the administration to hear. And we are also here today to demonstrate that the Affordable Care Act has a number of benefits already in place in New York that are helping many New Yorkers live healthier lives, get access to coverage that they didn't already have, and it's putting us on the path to real health care reform here in New York State. Today we're here to demonstrate to you the ways in which the Affordable Care Act is already working, so that we can set our sights on the health insurance exchange, the cornerstone of this law implementation here in New York, so that we can achieve full reform that we need to in New York. We have 2 reports today that you're going to hear about, and here today to introduce the first report is Bob Cohen from Citizen Action, a steering committee member of Healthcare for All.
Echo what Sherry said. Citizen Action of New York Public Policy and Education Fund, who put out this report, is our research and education arm, and we too join in praising Governor Cuomo for mentioning the exchange in his State of the State address, and we hope that the legislature will follow through with Governor Cuomo's lead and pass exchange legislation this year, and as soon as possible. The sooner the better, as Sherry said. So what we did with our report, we call our report the Affordable Care Act in New Yorkers, the gift that keeps on giving, and I think that really just summarizes the theme of the report. The point of this report is actually really simple. We didn't do a really detailed analysis. We simply collected what is out there, some other wonderful reports that have been done by national and state folks, and collected in one place in 20-something pages what the Affordable Care Act is already doing for New Yorkers and what we hope it will do and expect it will do in the future when exchange legislation is passed, hopefully this year. Because one of the issues is, in terms of the Affordable Care Act, it's very interesting in terms of the polling, which is, it's no secret that Americans are split. I think New Yorkers are probably tilting towards supporting it, but on a national level, Americans are split down the middle if you ask the question, what do you support the Affordable Care Act? However, if you simply ask them about different provisions in the law, and the most notable one is the exchange, if you ask them, do they support them, there's overwhelming support. And I think I was really shocked, and I've been doing this for years, at the data that Kaiser, the so-called Kaiser tracking poll, had in December, because, and they're the #1 really nonpartisan source on healthcare information and healthcare polling, and they found in December that 79% of all Americans support an exchange. I repeat, 79%, 4 of 5 Americans. And that includes 92% of Democrats, 75% of Republicans, and I'm sorry, 75% of independents, and even 62% of Republicans. So, you know, the rhetoric that's out there doesn't necessarily reflect what Americans and New Yorkers are saying or thinking as they sit around the kitchen table. So what's the reason for the contradiction? And what I think and we think is that Americans and New Yorkers don't always know what the law does. In fact, 4 in 10 in the same survey said that they're not sure how the law will affect their own families. So I think that's how you explain, while there's uncertainty out there, which is what explains why half of Americans say they support it, half they don't. It's an ideological question, but when you confront them with the facts or tell them the facts, they're supportive of the law. So that's what we're going to try to do very quickly today. And I tried to pick out just selective numbers from the report. This is not everything in the report, and our report doesn't have every provision of the bill. So the benefits of the Affordable Care Act today, millions of New Yorkers, and all these numbers of New Yorkers will benefit from the ban on lifetime limits in insurance policies. 2.6 million New Yorkers, and it's actually higher than this. This was a portion of 1 year. Don't have to pay co-payments or deductibles for preventive services, so if you go to the doctor. This is insurance in insurance policies. 285,000 small businesses are eligible for the small business tax credit that exists today that helps them buy insurance for their employees. Seniors and people with disabilities that are on Medicare, they're covered by the Medicare program. There are numerous Medicare improvements, but the one I focused on today is 252,000 and change New Yorkers receive $250 check in their pocket, including my father. It's one of the only times he's ever mentioned anything that I personally was involved with. He told me he received a $250 check. And I said, Dad, I didn't even know you pay that much for your prescription drugs. So it affects all of us directly. 1.2 million New Yorkers, again, these on Medicare, got the preventive services coverage, which is a different type of coverage than insurance. And 100, and this is another one that parents love, and I'm not a parent of somebody under 26 yet, but she's entering college. So 191,000 young adults are eligible for coverage, to be covered onto their parents' plan. So basically, parents can cover your son or daughter if, as many young adults are in that position today, unfortunately, they either don't have a job when they leave college or leave high school or leave trade school, or the other possibility is they're a freelancer, it's very common in New York, or something like that, where they're simply not getting coverage. They can get it up till that age. And then children with pre-existing conditions, this is already in place today. We weren't able to come up with another number, but extrapolating from the national figures, we can assume thousands of New Yorkers have already gotten coverage immediately, rather than having the waiting periods that exist under current state law. And I'm going to run over to the other side so I can see our other chart, which is what's happening in the Affordable Care Act in the future. And a lot of this is contingent, as Sherry was sort of leaning into, on what enacting exchange legislation, and some isn't. quite frankly. But what we need to do is enact an insurance exchange in New York State so that we have an integrated healthcare system in New York, and our state policymakers can begin to start enrolling people and begin to act and do all the planning necessary for an exchange. So here's some of the numbers that have been developed by others, but we're mentioning them today because they're really critical to seeing what's going to happen in the future. There's roughly 1 million New Yorkers that are eligible for the exchange, and 700,000 are eligible for the premium tax credits, which is a subsidy to purchase insurance on the exchange. So these are individuals that couldn't afford or have difficulty affording health insurance and will be able to hopefully afford health insurance today. And the ranges in terms of how many will actually become insured go from a low of 800,000 to a high of 1.2 million. It could be higher than those numbers, conceivably lower, but it's still a significant number. And we expect 650,000 that will be enrolled in the exchange, and those individuals will get good health insurance choices, affordable rates, and a watchdog to protect them, and get the benefits of the wonderful consumer assistance that's already in place in New York State, run by Community Service Society. Many of us agencies participate in that and provide services, but in addition, with the exchange, there's going to be hopefully expanded consumer assistance system so consumers can enroll and navigate the health insurance labyrinth in New York State. And we wanted to come up with some numbers on how it impacts people with serious health care needs, because they're often forgotten or not always focused on. These are folks that often can't work for obvious reasons, and they will be covered by Medicaid. And here are some of the numbers. I'll just read a couple of them. 7,300 with cancer and 35,000 with diabetes are expected to be covered as a result of the Affordable Care Act. And I've saved the best for last. I said it's the gift that keeps on giving. An analysis by Families USA, which is a nationally recognized consumer group, found that the average New York household will get $1,161 better off when healthcare reform is ultimately implemented. They took a year in the future after the exchanges are in place. So, you know, I'm not one necessarily who always talks about the bottom line, because we also have to talk about quality. But if you wanted, people are concerned in the economy today, where am I going to be? Well, your average New York family is $1,100 better off every single year. And I think that that's really dramatic and highlights why we need to have legislation passing an exchange in New York this year. Thank you.